Hi, my name is Lisa. I am the dermaesthetic therapist for Skin Store. I also do the product recommendations. I trained at Isaac Carson's Academy in Stellenbosch for 4 years, and I of course love everything skincare related. All of the products mentioned in this video will be available on our website. It is available at www.skinstore.co.za. So the routines that I will mention in this video are very, very basic. They are just a starting point for you to use, or a building block to use, on which then you can build even further in your routine, so you can then start adding in your actives or your serums or your toners. So this will be then very specific on what you want for your skin or what your skin needs. So I will only be focusing on the basic products that you need to use for your specific skin types. There are 4 different skin types. You have your oily skin type, you have your alopecia skin type or your dry skin, you have your balanced skin, so it's not too dry, it's not too oily, and then you also have your combination skin. I like to treat combination and oily skin together because they both really benefit from using salicylic acid. We of course don't want to overstrip the skin with the salicylic acid, but salicylic acid is a oil soluble molecule, so it helps to really get into the pores to clear out any congestion, and it also helps with excessive oil on the surface of the skin. So the first 2 skin types that I'm going to talk about is oily and combination skin. This routine can be used for both oily and combination skin. It really helps to get into the pores and clear them out. It'll also help with congestion and excess oil on the surface of the skin. I know when it comes to oily skin, we naturally want to strip off that oil and remove all of that oil, but that is not the best approach. We don't want to strip the skin of anything. We just want to remove the excess of the oil. We still want to maintain the skin's barrier, because if we strip the skin too much, it can impair the barrier, and then that just creates a whole new set of problems. So first off, I recommend the La Roche-Posay Effaclar cleanser. You should always remember to double cleanse, especially if you have very, very oily skin, or if you are wearing makeup during the day. It is recommended to remove the makeup first and then double cleanse your skin. You can also cleanse your skin in the morning with this, and that is what I recommend as a cleanser. So another little thing that I just want to mention about the Effaclar foaming cleanser is that it should not be used over the eye area. Please do not use this over the eye area. Your eyes will become very, very sensitive, or your eye area will become very sensitive and quite dry. As I said, it does contain salicylic acid, which is quite a stronger acid. Then for the next product, while we're on the eye area, I would recommend using the CeraVe Eye Repair Cream. This is just a great overall repairing cream that will help to keep the eye area nice and moisturized. And then as a moisturizer, I would recommend using the La Roche-Posay Effaclar Duo Plus M. You can use it in the morning and in the evening. You use it after cleansing your skin, of course, and then also during the daytime. This is my absolute favorite sunscreen, as someone who has very, very oily skin and who's very acne prone. This is also a great SPF to use if you are a very active person, if you're a very outdoorsy person. And this is the La Roche-Posay Anthelios UV Immune 400, the oil controlled gel cream. So it looks like this. As I said, as you can see, it is my favorite SPF to use, and I feel like it is just a really wonderful overall SPF. Please remember to always apply it on the face, the ears, the back of the ears, this little inside part of the ear, and then of course the neck, back of neck, and the chest area. And also, if you are not wary, if your shoulders aren't covered, then also please remember to apply sunblock onto your shoulder area as well. So another product that I love adding into the oily or combination skin routine is the Effaclar Ultra Concentrated Serum from La Roche-Posay. And I love the serum because you only need it about once to twice per week, and it really helps if you have a lot of congestion, especially on the nose, those little blackheads. And you can also use it if you have post-inflammatory hyperpigmentation, so post-acne marks. Because sometimes I know we do like to do some bathroom surgery and pick at our skin, and then unfortunately it does cause those red marks to form. So this is a really nice one to add in 1 to twice per week. I would not recommend using it every night if you're using it for the first time, but if your skin is fairly used to it and you've used it for a while and you can tolerate it every night, then you can, but just beware that your skin can become quite sensitive if you do use it every night. And of course, this is a peeling product, so you do need to be very strict with wearing your SPF. You don't need to be strict with wearing your SPF every day, but with this one you need to be extra strict. For the next two skin types, the same routine can be used. The only difference would be the cleansers. So if you have more of a balanced skin, your skin is not too oily, it's not too dry, then I would recommend using the CeraVe foaming cleanser. If your skin is a little bit more on the drier side, you have a little bit more tightness in your skin, or you see some little dehydration lines, then I would recommend using the CeraVe hydrating cleanser. It does have more of a cream consistency. Both of these can be used twice a day, and always remember to remove your makeup first and then double cleanse your skin. So for the rest of the routine, I would recommend using the La Roche-Posay Cicaplast Balm. This is just a really nice, nourishing, moisturizing, soothing cream to use on your skin. And it's also really nice if you have sensitive skin. Just do not use it around the eye area. You can also use the CeraVe eye repair cream with this routine. And then next in this routine, this is just a little add-on. You don't necessarily have to use it because the Cicaplast is quite nourishing and moisturizing. But if you wanted to add something extra in, I would recommend the CeraVe Hydrating Hyaluronic Acid Serum. Again, this is just a nice add-on if you want a little bit extra in your routine, a little bit more hydration. And of course, then with every routine in the AM, please do end it off with a SPF. So this is a really nice one for balanced skin and for dry skin especially. So it's the La Roche-Posay Antelios UV Moon 400 Hydrating Cream SPF. So it looks like this. And that is what I would recommend for dry and balanced skin, or dry or balanced skin. Please also just remember that when you start using new products, it can take anywhere from 4 to 6 weeks to see a difference. This does, of course, depend on the product. Some do work quicker than others, and some just need a little bit of time. Especially with something like congestion, it can take a little while for that to resolve. And then, of course, if you are pregnant or breastfeeding, double check with your doctor if you can use certain products. And then I also do recommend that you always double check the ingredient list on the products before you buy them, just to see if you might be allergic to any of the ingredients in there. For instance, if you have an aspirin allergy, please do not use salicylic acid based products. You could potentially have a reaction to it. Just another little reminder, all of the products mentioned in this video can be found at www.skinstore.co.za, and please comment your favorite skincare product down below, and remember to wear your sunscreen every day.